Okay. Good evening. This is Paul Lynch. I'm doing day 6 of my experience working in the ICU in New York City during the COVID-19 pandemic. A lot of people have reached out to me and commented that the videos are hard to watch, and I have to tell you they're hard for me to make sometimes. It's hard to come home from work and immediately talk about what's going on. It's very emotional. But I think to switch things up today, I really want today to be a happy video, to tell you some of the positive stories, some of the great things that are happening. So I'm gonna do my best to focus on that today. If nothing else, just for a change, because there is sad and there is death and there's dying, but there's also wonderful, wonderful healing and happy moments. And so I want to talk about those today. So the first thing that I want to talk about is just how thankful I am for the military. Last week, as I was getting here, 2 anesthesiologists from the Navy showed up and said they were here to help, and they were kind of grizzled veterans who had been through Iraq and the wars, and they'd seen war zones of a different type, and they said, "We'll do whatever you want us to do." And it was just so awesome to see their serving spirit. And as I talked to them, the military actually deployed 200 nurses and physicians in New York City to help us, and we have a bunch in our hospital. What was really cool is our anesthesia department downstairs has kind of like headquarters set up, and we have, as I've mentioned before, the line team and the airway team and the code team and the ICU team where I'm working this week just to manage the patients. But there's another team that doesn't get as much attention called the prone team, and literally these guys go around all day long. There's 6 on a team, and they lift a patient and they flip them upside down and they ventilate them on their stomach. But it's really hard to do because you have to make sure all the lines and arterial lines, and some of them are getting dialysis and central venous lines, that everything is turned just very carefully so you don't pull anything out and you don't hurt the patient. And so these 2 military guys with all their experience and decorations basically said, yeah, put us on the prone team. We'd love to do that. And so for the last 5 days or 6 days, they've gone around room to room to room, flipping patients, because you can't keep a patient prone all day. So we usually leave them 16 hours prone and 8 hours supine. And so they've gone around, and whenever I see them, they're smiling and they're working hard and they're sweating because they go into the room and they put all this PPE on to protect them. And so they've got goggles and masks and robes and gloves, and they come out just drenched in sweat. And so I wanted to show you a couple pictures of these guys. So first of all, these are some of the military guys right in front of Bellevue as they're showing up. And then this is 4 of my friends that showed up to help me in the anesthesia department. John and Ted are 2 guys that I spend a lot of time talking to every day. Just wonderful human beings. And then here's a picture of them coming out of rooms, just drenched in sweat. The guy on the right is actually a resident here in training. And on the left is a good friend that I've made, anesthesiologist, who's here to help us. The last thing I want to tell you that was really positive for me is I'm a pain management doctor, and I put in epidurals all the time to help people with pain. But today I had the opportunity to put in what I call the best epidural of my life. There's a lady that had COVID, and she also had a terrible trauma. And so she came in with 2 insults. She had 16 fractures of her ribs on both sides. She had bilateral pneumothorax on both sides where both lungs collapsed. And she went through massive surgery. And when she got to the ICU, on top of having fractures up and down both sides and pneumothoraxes, or pneumothoraces as we say, she also had COVID. And so she couldn't breathe. She couldn't take breaths because she was in so much pain. And they called me as a pain management doc and asked if I could put an epidural in, and specifically a thoracic epidural catheter that we would thread up. And what we would do is infuse medications, which would allow her to take a deeper breath. And so that's what we did. We went into the room, we got gloved and gowned and put on all of our stuff and turned her on her side and placed an epidural rather easily, actually. It wasn't that big of a deal. We didn't have x-ray guidance like I normally have and all the, the things that make it easier back home. But we were able to place this epidural, and when we turned it on, we all kind of looked at each other and said, you know, this is an epidural that could literally save her life, because oxygenation is such an issue with these patients that have COVID. So that made me so happy that that I have a skill set that can save people's lives, even if it's just something as simple as an epidural. So that was pretty happy too. So I'm definitely going to keep this video happy today. So the last thing I want to do is give a teaching point. My teaching point for today is the importance of protecting yourself. And I've got 4 or 5 things that I want to say. First of all, if you come to work in an environment like this, bring your own PPE. The hospitals all say that they have plenty of PPE. And as I've said on some of these other videos, that's kind of true, but kind of not. Sometimes they just don't have the logistics to get the PPE to the right place at the right time. And so I was so lucky on the last day before I left, I ordered a book about the ICU that I wanted to have with me so I could read. And it was from the medical library at Midwestern University, a medical school in Phoenix. And we called to get it, and they said that they were closed and they could deliver it, but that wasn't going to be fast enough. And the lady on the phone actually said, well, no problem, I'm going to bring it to your house, which was just such an incredible gesture. So this librarian brought it to my house, and when she dropped it off, she dropped off an entire bag of gloves and Purell and face masks and N95s, and it was such a touching gesture. And I thought, I'm not sure if I'm going to need these or not, because the hospital should have all of it, but I brought it. And I'm so happy I brought it, because every day I've grabbed new N95s and face masks and all sorts of stuff from the supply they brought me. It meant so much to me. So if you ever do something crazy like what I'm doing, bring your own PPE. So that's number 1. Number 2, constantly wash your hands. Wash your phone. Most of these phones are waterproof now. I wash my phone 7 or 8 times a day. If I touch it, I wash it. By the way, don't touch your phone a lot when you're working in an environment with COVID. I'm on a unit right now where every single patient has N95 and probably 30% of the staff. And so I try to wear a mask all the time, and I'm constantly washing my phone. I could go on, but the last thing I'll say about protecting yourself and PPE is when you get home, you have to get into a routine. There was a study done that showed 50% of healthcare workers when this was done in Wuhan during the epidemic, 50% of them, when they left the hospital, had COVID on their shoes, on the soles of their shoes. So what I do when I get home now, I change at the hospital and I put on clean clothes. And then when I walk home, as soon as I come into my hotel here, I take off my shoes, I leave them by the door. I take off what I was wearing and I put that in a bag to be washed. I wash my phone, I wash my badge. I immediately take a shower. I don't have anyone here that I'm going to infect, but I don't, right now I haven't contracted it and I don't want to get it, so I don't want to bring it into my apartment. So if you're working in an environment with COVID, do everything you can to protect yourself and not to infect others. So I'm almost done, but I did want to say one last thing tonight. Many people have reached out to me and said they're praying for me, and that means a lot to me. I appreciate your prayers. But tonight I would just ask you, instead of praying for me, all 6 of my patients that I started the day with are still alive. And I'd ask you tonight to pray for them. They're all very critically ill and very close to death, but we've been able to keep them alive. And I pray that you will pray for them. There's one patient in particular that I talked about last night that sends 50% of his paycheck home every week to Mexico, and his family depends on him. I pray you'll join me in praying for him, that he'll make it through it. That was day 6. Thank you for watching. Tomorrow is my first day off. They tell me I had to take a day off because I was going to wear myself out. So Wednesday, tomorrow, I'm going to take a day off. So I'm not sure if I'll make a video or not tomorrow, but definitely I'll be back on Thursday. God bless you guys and stay safe.